Hello, everyone. Thank you for having us today. So let's move to the telehealth. So telehealth for disaster response. So let's start from this, big image, which I usually also share with students. So this is the beauty of implementing telehealth for different healthcare systems. And here you can see that, for example, we can think about implementing telemedicine platforms based on some big hospital, which usually also has some EHR, electronic health record system, which of course telehealth sometimes can be a functionality of EHR, or telehealth platform can have their functions of EHR, so they can nicely live together. But usually we have different interfaces for patients and clinicians, and also a big admin part, just to be sure that every functionality works well, that the workflow is going smoothly. Basement of telehealth, of course, it is a communication channel. And usually we discuss something like audio and video, but the example of Ukraine shows that texting is actually quite important functionality, and we shouldn't forget about it. So electronic scheduling is really giving the flexibility on both sides of clinicians and patients, just to work more efficient with the timing. And for different healthcare system, it can be really important to have a good, strong billing system and online payment. So here you can see that actually this hospital can be connected with different remote clinics or rehabilitation centers or centers of disease and control preventions. And of course, with some remote clinicians and patients, and the entire workflow and data flow can nicely, organized, and also with some functionality of reporting to insurance companies and to the Ministry of Health. And if we think about the Ukraine telehealth relief, of course, we followed the main goal. We wanted to help a lot to Ukrainian healthcare system to cope with this difficulty, especially in the first days of the war, where access to the medical care was really difficult, or in some locations. And we, from the very beginning, put a lot of effort to start to work as a psychological support, not only for patients, but also for the clinical colleagues. So as Hisham mentioned, we achieved quite big numbers of telehealth consultations within Ukraine. We're also working in other locations. And I may say that now we can cover almost the entire spectrum of medical care with the collaboration with the different partners and different NGOs. The big achievement is the network of volunteers, the network of organizations. And here the response, again, from global community of clinicians, medical professionals, psychologists was really, really big. So let me show you and explain a bit in details the timeline of the implementation for Ukraine. As Hisham said, we made call to action. You can see this blue line almost on the second day of the war. It was mainly on the social media, but it was quite precise message to the community. So to whom we really want to kind of invite on our side to make a group and to organize the response. And we received during almost 2 days, 240 applications from clinicians. It was overwhelming with the different telehealth solutions and companies who wanted to participate in this move. And you can see that in parallel, we did different activities. On one side, if to split them, we made vetting process and onboarding for clinicians. And from the other side, it was a huge work of implementing telehealth solutions and adjusting them to the needs of Ukrainian healthcare system. So I would like also to mention that our key partner in Ukraine is the platform Doctor Online. It's interesting telehealth solution with many, many bright ideas with functionality. But also in the middle, let's say in May, we received a huge help from Doximity, which is American telehealth platform, and they provided us with the vetted clinicians from their side. So we had the second big pool, a group of vetted clinicians, which we managed to onboard as well. A few words about unique challenges. And if I would choose one, the main challenge, of course, it was time pressure. And this challenge we put on ourselves by ourselves. So we wanted to implement telehealth as fast as possible. We received so many applications from volunteers, so we felt the deep responsibility to onboard these people on telehealth solutions and to give them opportunity to work and to help patients. The perfect setup if the telehealth platforms from the local country, as we have the nice example of Doctor Online, because they had quite good coverage inside Ukraine already. So help of the local organizations, including NGOs, and of course the government bodies like the Ministry of Health is really helpful. And from the very beginning, we wanted to be really compliant and meet all requirements from HIPAA side or GDPR side from European Union to really implement the telehealth solution and not using some like a WhatsApp functionality or Telegram or other channels. The digital outreach, how to bring this information that telehealth exists, that patients can come, that they have enough clinicians. So here we also had a nice support from the Ukrainian parliament, which announced that in the list of telehealth platforms available for the population were two our partners, Doctor Online and Vivero Health. Security and safety. This is a very specific challenge, especially for this exact implementation. And really our partners did their best and doing their best to be resistant for the cyber attacks. We are quite lucky because we have many people from the, as I said, former Soviet Union countries, including Ukraine. So healthcare system of Ukraine was quite familiar for us. So we understood the local context, we understood the magnitude of language barrier, and we also know quite well the level of digital and health literacy. And in Ukraine, digital literacy is quite high. The population is quite open to solutions like telehealth, and they use it quite, often. So another thing is that we, of course, in time started to be both us and our partners quite flexible to some new challenging needs. So you need to really fix some of the functionality or to add some additional functions. And for example, onboarding was one of the points which we fixed together with Doctor Online, because one thing when you onboard, let's say 10 or 20 people per day, but when you onboard 250 clinicians once, like in a moment, this is really challenging task. So here I would like to show you some, let's say, basic requirements. Nowadays we are very lucky because the majority of solutions are really focused on the telehealth as the main functionality. Usually they meet all these requirements, but anyway, it's good to have it. We usually use not only the list, but we use like more complex things like in matrix, where we have the priority between the requirements, weights, and multiplying these things just to make the proper assessment of different telehealth solutions or other solutions from digital health domain. So you can see it here. We also wrote the big article for New England Journal of Medicine, where you can read in details all the steps which we made during the implementation for Ukraine. So onboarding clinical volunteers, one of the big challenge, as I told you. So when you do this for hundreds of people simultaneously, it's really important to have detailed text and video instructions, to have 27 service support and technical support. And another point, that implementing telehealth for war zones or the zones of the crisis requires the training how to work with patients from these territories. So the patients with the mental health issues. And thanks to Yeshiva University, from the very beginning, we made these courses. They were available for our volunteers. So a few key takeaways from our experience, that Healthcare Without Borders, actually, we demonstrate the ability to deploy really fast emergency telehealth solutions, even in the wartime conditions. As we said, the precise and articulated call to action can attract good response from the global community of volunteers, including tech companies, including academia, including medical professionals, psychologists. Collaborating and having a big network, this is one of the key components. There are standard requirements. There are also unique and specific requirements for disaster implementation. Now we are looking towards the simplicity, because usually during the disaster response, if you have like fresh new volunteers, if you have another location, it should be really easy process how to onboard both clinician and patients and how to start quickly. So usually we are looking towards the minimum but mandatory functionality, I would call it this way. So, and again, about the deployment and onboarding, if you think about this, and if you structure this approach and make it very logical, it will be much more efficient, and you will save tons of time, both on your side, on the side of volunteers, on the side of your partners. And as I said, we make always assessment of the country of deployment, which is really critical, because sometimes, for example, you can have from 10 to 15 local languages. You can have a very low digital and health literacy in population. So these are really important factors which can, from one side, bring success to your fast deployment, from the other side, can be critical and bring a lot of risks. This is how we build digital ecosystem within the Health Tech Without Borders. And dark blue pillars are main programs which we focus on. So we implemented telehealth. We also implemented the concept of virtual hospital. We pay a lot of attention to grow education and the health literacy pillar. And the mental health is also a big part. But on the left side, you can see that we want to structure our approach while implementing different digital health technologies. And here, usually I use the Stanford approach, where you can see the different types of domains of digital health, starting from new clinical care models, moving to health IT infrastructure and data management, then different types of algorithms, including AI and machine learning, wearable and medical devices, and also mobile and web applications. And here, different types of digital health solutions on the left side, and on the right side, a different type of medical specialties, nurses, and different patient groups, because I think that you cannot implement everything for everybody. So we should really be focused on and put some priorities for different locations and for different needs. So, and the green and yellow and red lines, this is different stages of our implementation of different types of solutions. So we are also looking forward for the next big product, which we will launch together with Microsoft. This is a chatbot for post-medical aid. Another big piece is Health Tech Without Borders Academy. We successfully launched, and now we have our first course for the students of Chitkara University. And we wanted to record the first-hand experience from the leaders and experts, not only from tech companies, but also from academia and, of course, medical professionals. And now we are working with the big network of our partners, including the Massachusetts General Hospital, Stanford and Harvard Medical Schools, but also our partners like Shiver and Cut Medical Schools, and Microsoft VC and Butterfly Network. I will leave you 2 links for recent articles about implementation. Especially, I would like to pay your attention to the first one. And of course, we have Health Tech Without Borders Academy YouTube channel, where all our recordings from all our experts are available for the wide audience. Thank you so much.